Thousands of people that we know have contracted the coronavirus globally and the United States. More than 100 people are being evaluated for possible infection.
Joining us via Skype to shine some light on what the virus is and the seriousness of the outbreak is Dr. Tom Frieden. He's the president and CEO of Resolve to Save Lives, and he served as the director of the CDC under President Barack Obama. Doctor, thank you so much for joining the show. We really appreciate it.
Thank you for having me.
Absolutely. So, doctor, can you just give us a scope of the size of this outbreak? About should people in the United States be worried? And let's start with that. Should people in the United States be worried about this outbreak? And are you confident in the CDC's ability in order to handle it?
First off, this is a very serious outbreak. It is spreading widely. It appears to be more infectious than the SARS virus was in 2003. And though it is somewhat less deadly so far than SARS was, it's still far more deadly than a mild virus that spreads. So we're very concerned about this, both for China and globally.
Mm-hmm. And what are the symptoms? What are people experiencing? What should people be looking for if they and should cause them to go in and get checked?
Well, first off, the people at risk are people who have had contact with areas where this is spreading. So currently, this is widespread in Wuhan, China, and it appears to be spreading or present in many other parts, if not most provinces of China now. So for those in China, there's obviously a different set of concerns than those who don't have contact. For most people in this country, in the U.S., at this moment, there is very little risk because the risk is from exposure to someone who has the infection. There's a lot we still don't know. And one of the things that's crucially important is that we get more information as rapidly as we can. The more we know, the more we can do to protect people. But what we do know now is that this is spreading and it can be deadly. Mm-hmm. What we really need to do is address things in the short term in terms of China and the global response to this novel coronavirus, and also think about what the implications are for the medium term, because we keep seeing the same thing over and over and over. A new outbreak emanating from somewhere in the world, causing a devastating crisis that costs billions of dollars and kills a lot of people. Many of them could have been prevented or stopped or controlled. And that's what we need to do more about. But for most people in the U.S., the key is wash your hands regularly, cover your mouth and nose when you cough or sneeze, don't go out if you're sick. And if you have contact with someone from China, particularly from Wuhan, who's just returned, see if that person is ill. And if anyone who has contact becomes ill with cough, fever, or other symptoms may indicate an illness, such as we're not sure of the whole range of symptoms with this disease, but cough and fever seem to be the predominant concerning symptoms. Immediately contact a healthcare provider, let them know about that connection with China, and get assessed.
Mm-hmm. So, doctor, you ran the CDC. I'm sure that you often had contact with foreign governments, including the Chinese government. There's quite a bit of concern here in the United States that during the SARS outbreak, the Chinese government was, let's just say, not forthright with some of the information about what was going on with that outbreak. How can we be certain that the information that's being provided to us by China is correct? Are there mechanisms in place via the WHO and the CDC? Maybe take us behind the scenes into something like that.
The US CDC, following SARS, has had a very close relationship with China's CDC. During my time at CDC, we had regular, at least annual meetings. We exchanged staff. In fact, when they had a new flu virus that emerged, what's called H7N9, we had CDC staff working side by side with Chinese staff investigating. My sense is that there's not quite as close a relationship now, perhaps because of the broader tensions, but health can be a bridge. Health can be a way that countries can work together, because ultimately we're all connected and we do have a common enemy. Our common enemy is the dangerous microbe. And really, epidemic prevention should be a politics-free zone. In terms of the data coming out of China, I think there are a couple of issues. One is, what do they know? And the second is, what are they sharing? The first of those is really more difficult to gather than you might think. Early on in an outbreak like this, there is kind of a fog of war experience where you have lots of information coming in. It's hard to sift out accurate from inaccurate. That's why really meticulous, rigorous, what we call field epidemiology is really important, where you identify what's the case definition, what are the symptoms, what are the contacts, what are the connections, and you figure out, for example, how did it spread within a hospital? Are there super spreader events where one person is infecting many others? What's the full range of illness? Are there people who have the infection and not many symptoms or no symptoms? There clearly is at least one written up in the medical literature just on Friday. But are people spreading it before they have symptoms or even if they have no symptoms? Those are crucial questions, and we don't have clear answers at this moment.
Mm-hmm. And how are decisions made on our end with regards to travel recommendations or even potential travel shutdowns? How are those sort of decisions arrived at?
The CDC provides the technical guidance. The State Department and the administration broadly would provide the overall policy guidance. But the CDC can say from a technical standpoint, as I believe they have at this point, avoid travel to China at this point. We don't know how widespread it will be in the coming days and weeks. So unless there's a crucial reason to go, better not to go at this point.
Mm-hmm. And so, Doctor, I mean, that is one thing. I think a Morning Consult poll shows that 50% of the American public, at least majority, would support travel restrictions on China. As a CDC director, how do you balance, public outcry versus maybe some of the technical aspects? You were there, for example, during the Ebola virus. Maybe take us into the mindset when something like this is occurring.
One of the things that's important is to try to get the facts out to be early, right, credible with what's happening. I think here it's important to admit there's a lot we don't know. And the information is changing not just by the day, but really by the hour as we learn more. It's a very concerning virus. And to know exactly how we may be able to limit its spread and whether or not it can be contained is something that we'll have to investigate in the coming days. We'll know more within days about how this is spreading and what can be done about it. At this point, we need to make sure that people who may be ill are rapidly isolated. And it's very important that people who are in healthcare facilities, health workers, think about the possibility of this virus so that patients don't end up not being isolated and then spreading it to healthcare workers and other patients. Because what we saw with both SARS and another coronavirus, MERS, is that hospitals were one of the main places where they spread. It's particularly important in healthcare settings to be vigilant and rapidly isolate and test people who may have this infection.
Yeah.
All right, Doctor, thank you so much. We really appreciate your expertise.
Thank you, Doctor. Thank you for
today.
your insight.
Thank you.
Next on Rising, my conversation with Congressman Mike Gallagher about the UK's plan to utilize Huawei technology. That's when Rising continues.